I'm Kenya Brown, and November is Lung Cancer Awareness Month, a time to raise awareness about lung cancer, which is the leading cause of deaths in Black Americans. Unfortunately, Black Americans often face barriers to cancer care and are less likely to receive timely recommended screenings. As a result, they are more frequently diagnosed at later stages, which significantly impacts survival rates. Joining us today is Dr. Greg Hall, an internal medicine physician at University Hospitals, who will walk us through the essential cancer screenings and explain why early detection is so critical. How you doing, Dr. Hall?
It's great. Great to be back here with you, Kenya.
Absolutely. We always have some great information for our listeners on how to take care of themselves and their families. And if this is not maybe the conversation for you, you definitely want to share this conversation because you just never know who might need to know this information. Now, Dr. Hall, what are some of the most common types of cancer affecting the Black community? And why are cancer prevention screenings so important?
Well, like anything, the main cancers being lung cancer awareness month. Lung cancer is the number one, cancer out there overall, and then of course breast cancer and colon cancer, and those are all big things. And we've made tremendous strides since I started in practice 30 years ago, in really lengthening how long people live after the first diagnosis, curing them completely. We just made such advances, and that's mainly because of screening and finding cancer sooner. I mean, when you find I always say it's like the dandelions in your front yard. If you see one dandelion, go over and pick it, because if you
Yes.
don't, 2 weeks later you're going to have 15 or 30, right? Because if you can get the one before it spreads, that's so critical, and it's so much less work, right? And maybe it's an awkward analogy, but if you can find cancer early when it's in one spot before it spreads, it's so much easier to treat. Now, prevention, like we talked about, being able to go through these screenings is critically important. And unfortunately, with African Americans, we kind of don't like the doctor. We don't want to go to the doctor. We don't want to get screened. If you find some, my father used to say, if I have something, I don't want to know.
Yeah.
Right.
It's
And so,
scary. It's
so
scary.
many people, so many people, but if you have something, I want to find it early. If you have dandelions, I want to find it when you got the first one, right? I want to go over and pick that first because it's so much easy for everyone, right? And so if you have some early cancers, can be so well treated, to be eradicated, you can get on with your life. If we kind of stick our head in the sand like my father used to do and say, I don't want to know till it stops me, then when we diagnose it at some late stage, it's just a big disaster. So, prevention is really the key.
Absolutely. And so, what would you say to, maybe help out a family member to get them to get these screenings? What types of things can we arm our listeners with?
Well, one of the things that, as a man, I'm so happy that we can do PSA lab tests, right? So in the old days, I used to have to stick my finger in people's bottoms, and it wasn't fun for them. And trust me, it was not fun for me either, right? And so no one was enjoying that process, but that's how we screen for prostate cancer. So now there's a blood test. No one has to get undressed. We're going to draw your blood and check your cholesterol and all the other things that we check anyway. We just throw in a prostate cancer screening test. And Black men, as you know, are just so many more times likely to get prostate cancer, to get advanced prostate cancer, and to die from prostate cancer. So the fact that we've gone from a rectal exam to a blood test is just been dramatic in terms of our ability to diagnose it early and to not have to argue and fight. I mean, all of those things have made a big difference.
Yes.
Advances in breast cancer has been the same thing, and so we don't do a lot of breast exams, and you don't really hear, if you think about it, people aren't saying do your monthly self breast exam. We aren't really saying that because when you feel a lump or when I feel a lump, it's way further along than it needs to be. Whereas a mammogram can see little tiny microscopic changes in a woman's breast that would indicate there's an increased risk for cancer way before it gets big. So again, when I started 30 years ago, we'd have people with mastectomy. By the time you felt a lump and I felt a lump, they'd have to take the entire breast off because that
Yes.
cancer had spread that far by the time we found it, waiting to feel it, right? But
Right.
now we don't need to wait to feel it. We have a mammogram; it can see it way before we feel it, right? And
Yes.
now allow us to find cancer early. People have, they call it now a lumpectomy. They take the little bit of the tissue, maybe the size of a grape or something like that, and take it out and have some follow-up therapy. And now there are people cured, don't have to think about breast cancer. So those are the types of things. And lung cancer, last example for now, lung cancer was a death sentence 30 years ago. 6 month life expectancy. But now I have so many people getting diagnosed with lung cancer, and they just take that part of the lung out. There's a quick recovery. They're back to work. And so again, if you have lung cancer, it's best to find it early because they can take it out, they can treat it, and you're basically gonna die of something else. And so that's what medical advances have happened just since I became a doctor, and we need to hug on to that. I used to have a phone in my car. That was my phone 30 years ago, right? I didn't
Yes.
I didn't walk around with a phone. Now technology, I got phones everywhere. We don't even use our house phone. That's what's happened in the last 30 years. Well, those advances have also happened in medicine, and we got to jump on. We as African Americans need to jump on and take advantage of those advances rather than avoiding continuing to walk around using our house phone, which of course none of us do.
Absolutely. I mean, so listen, guys, science has advanced greatly. So give it a chance. Make sure you get these screenings because it could save you and your family a lot of headaches and heartaches possibly down the line. Now, what preventative screenings do people need and what age should someone get screened? And does that differ at all for the Black community?
Well, yes, it does differ, and the changes have. We'll start with colon cancer. For the last 25 years, African Americans have been indicated to get colon cancer screening starting at 45, and white Americans were to start at 50. But of course, no one paid attention to the 45, right? And then about a few years ago, they changed the screening for white Americans to 45, and now everyone's getting screened at 45.
Mm,
So at 45, you should get your colon cancer screen either through a colonoscopy where you drink the stuff and get cleaned out and they take an actual look, or through tests that actually analyze your stool, like Cologuard is
yes.
one of them, where you basically do a number two in like an ice bucket and they send it off, and then they examine it, and they can tell you whether increased risk for colon cancer or not. So even that's easier. I mean, my wife wanted to do the Cologuard. I wanted to do a colonoscopy, and so if you do a colonoscopy and it's normal, you can go 10 years. If you do a Cologuard and it's normal, you can only go 3 years. And so there's these differences on how you do those screens. There's other ones, but they're really inferior. You should do one of the two where they actually analyze your stool or they actually look. Those are the best ones. There's some of them they card you, rub it on the card. It's just not as credit, not as really as good as these more advanced ones. So that starts at 45. Breast cancer starts at 40 and should be every year. So the national recommendation would be start at 40 and go every other year. But
Mm,
because African American women have more earlier and more aggressive breast cancers, the recommendation is to have that done every year starting at 40. So that's different from the general recommendation overall. So 40 and 45 for those. Now with lung cancer, it's really more dependent on your smoking because smoking contributes so greatly to lung cancer. If you have a 20-pack year history of smoking, the 20-pack years, when you smoked a pack a day for 20 years, then you need to be screened for lung cancer, right? And that's a lot. I know that look on your face. That is a lot.
yeah.
But you also, I grew up on St. Clair near White Motor, so if you have an exposure to factories and you were inner city, you grew up in inner city and there's lead and stuff, maybe that in conjunction with less smoking might put you at increased risk because they can look at that. They can look at zip codes and see other people who have increased risk for lung cancer based on that. And again, if we find it, you don't have to die from it. We find it early. And but 20-pack years, but if it's 15, if you tell your doctor, I grew up by White Motors or I grew up, by a big like I did, or I grew up by a factory and I don't know what they were doing in there, you might have an increased risk for lung cancer from inhaling the dust that was around the factories. And so you want to think about that, and really be proactive. You should be going in and saying, when do I start screening for lung cancer? When do I start screening for breast cancer? Don't wait for them to come up with it, right? I think
Yes.
you should, can't you do a PSA? I mean, isn't there a blood test you can do for? We need to learn these things. Is why I'm talking about it now, so that we can nudge our clinicians, our providers, into doing what they're supposed to be doing, because the visits are short. You have agendas that you need to have addressed, and
Yes.
sometimes preventative things get pushed to the back. So
That's
really, if we know these things and not leave it to them to just screen me when it's appropriate, I think it's better.
absolutely. And we make much time to go shopping and different things for the end of the year. You want to think towards getting those screenings, making those appointments, trying to get on those calendars for the following year, because sometimes things just keep sliding. Oh, I'll do that tomorrow. I'll do that, whenever. So put that on your agenda to close out the year. Try to get those appointments for those screenings, and it isn't that bad for
It's not.
some of those screenings. It really isn't. You can drink Gatorade like now for the
Right, to get you
colonoscopy and
cleaned
stuff.
out. Right, right. Well, it's mixed with some other stuff, but it will get you cleaned out. I
Yes.
use the birthday approach, right? So during the week of my birthday every year, I go and see my primary care doctor, and I do all of those
Yes.
preventative things, and I call myself doing it as a birthday present to myself. And it allows me to remember, oh, here comes my birthday. I'm happy about my birthday, but I have to see my doctor. I have to make sure I have my blood pressure. I get my refills, all that stuff. I didn't want any screening I need to do is kind of when I think about it, because I want to continue to have birthdays. And so I mentioned that to my patients, like, attach it, how do you look away and 3 years has gone by? How was I supposed to, what was I supposed to do? Whereas if you attach it to your birthday, you'll have it more apt to remember.
Those are great strategies. Now, what role does lifestyle? We don't want to talk about our part in this stuff now, but what role does lifestyle, such as diet and exercise and smoking, play in cancer prevalence in the Black community?
And it plays a big part.
Yes.
Smoking, as we talked about, if you don't smoke, you don't need to be screened for lung cancer. Your risk for it is so low. I mean, there's secondhand people within secondhand smoke, and I have a patient that comes in, and almost every time I say, "When are you going to stop smoking?" She says, "I don't smoke. It's my
Oh,
mother. I take care of my mother, and she smokes, and
ah,
we're in her house, and I can't tell her not to smoke." So I say, "Oh yeah, I'm sorry, but you smell like you smoke." And someone who smells like they smoke has the risk of someone who smokes,
yeah.
to an extent, right? And so you need to go and talk to your doctor, about that. As far as lung cancer, as far as breast cancer, and really all the cancers, fatty foods, high meat, a lot of beef, a lot of processed food, a lot of fried food, a lot of fast food, all somehow give you an increased risk for prostate cancer, for breast cancer, and for colon cancer, which is sort of crazy, but it's direct. Um, Obesity too, which really sort of reached me, like being overweight puts overweight women have a higher risk for breast cancer than women that are normal weight, right? And so if you think, and it's not intuitively makes sense, but the data shows that clear as anything, right? That the more overweight you are, the higher your risk for breast cancer. And so when I think
Yes.
of the patients in my practice that have breast cancer, almost all of them are way overweight. And so yet another reason to really concentrate on losing weight more deliberately, because that is, if in breast cancer, obesity is it, and that's why it disproportionately occurs, more advanced in Black women, because Black women they're just bigger. I mean, that's just the statistics, right? And so thinking about sugary sweetened beverages, it's a whole nother podcast, but what I mean, all the things that
Yes,
really
we need to
relate,
talk about all these
right?
things too.
Weight, you're not just losing weight, but you're decreasing your risk for cancer. And the same thing is true for colon cancer. Vegetarians don't get as much colon cancer as people who eat meat. And people in Africa, and it's not about being African American, right? Do you know African American men have 10 times the risk of prostate cancer compared to West African men? So it's
Wow.
not the fact that we're part African that's done it, it's something else, right? I mean, it's something else. And so making sure that your diet, and certainly an African diet has far more rice, far more vegetables, far less beef and meat. You know what I mean? So
Yes.
thinking about, what we're supposed to be eating, which is fruits, nuts, beans, and vegetables, and then every now and then some protein in the form of meat. That's a diet that would lower our risk for colon cancer, prostate cancer, and breast cancer.
And I get it, guys. It is not always easy to just up and change everything, but I've lived through a few decades now, and your body changes every decade. The things that you used to be able to get away with, you may not be able to get away with them in this decade of life, and you want to have quality of life as you get older. You don't want to be broke down and all of these things. So please look into these. You can still make the healthy food taste good. You just have to look into some different ways of living. But thank you so much, Dr. Hall. We thank Dr. Gregory Hall for joining us today and sharing this valuable information with us. I always appreciate all of the great tips and things that you have for our listeners. And to learn more, visit wzakcleveland.com/BH365. Thanks so much, Dr. Hall.
Thanks so much for having me.